Good afternoon. We are coming to you live from the Court at Lawn Cantata. I'm here with Dr. Koshkarian, and we are from Pima Heart and Vascular, discussing exercise and heart health. We have a hybrid audience of in-person and online, so thank you all for being here. For those of you watching online, if you have any questions, please feel free to send them in. I do have Andrea here with me that can relay them to Dr. Koshkarian, and he will answer those before the end of the lecture. So without further ado, Dr. Koshkarian. Sorry.
Thanks very much. It's great to be here and give this talk, and both to the in-person people and to you out there. So I'm going to talk about exercise, which is a very important topic for a cardiologist, because that's one of the ways we encourage people to be healthy and lower the risk of heart disease. But people have a lot of questions about what the right amount of exercise is, and so I put this talk together to try to answer some of the questions that people have asked me over the years. All right, so first we'll talk about exercise and why it is good for you, but also delve into the ways it can be bad for you and some of the fears that people have, and are they founded or not founded. Then we'll turn to determining what the right amount of exercise is, and finally discussing types of exercise. And by the way, if you have any questions, feel free to ask. This is actually a fairly short talk, and it's built for people having questions. All right. So why is exercise good for us? So it leads to cardiovascular fitness, and by that we mean that the heart and blood vessels are improved with exercise. You know that athletes tend to have lower heart rates, and that's a sign that their heart is working more efficiently, able to do what it needs to do with a lower heart rate. But it's more than just the effects on the heart. When you exercise, you also improve your blood vessels. The blood vessels dilate more easily, and that makes the muscles that are exercising able to get blood flow more easily, but it also makes it easier for the heart to pump. So the heart pumping into more dilated blood vessels means less resistance, so the heart doesn't have to work as hard. There are effects on the muscles. So when we exercise regularly, our muscles change. Not only do they get stronger from a sort of a macro point of view, where you can kind of see your muscles and feel your muscles, but on a microscopic level, the muscle cells change. They develop more enzymes to extract oxygen from the bloodstream, so they also start to work more efficiently. So the combination of the blood vessels and the muscles changing means that the exchange of blood flow and oxygen in the tissues happens more easily, and again, this leads to the heart not having to work as hard. There's also indirect effects on the heart. So the risk factors for heart disease can be improved with exercise. High blood pressure is a common problem, and people's blood pressures tend to improve when they exercise regularly. Again, probably related to the fact that the blood vessels dilate more easily, and that leads the blood pressure to go down. Lipids, the fat in our bloodstream, cholesterol, triglycerides, things like that, some of those can improve. So the good cholesterol, HDL, tends to go up when we exercise. We also utilize energy more efficiently, so triglycerides tend to go down. The LDL cholesterol doesn't change as much with exercise, but the other components do, and that's also a benefit for the body and the heart with exercise. Diabetes control is improved in people who exercise regularly. That's again a combination of utilizing fuel more efficiently, but also the development of stronger muscles and more muscle tissue is something that leads to better glucose control, because the muscles use glucose, they take it out of the bloodstream, and that helps control of diabetes. And of course, weight. So it's very hard to keep your weight down just by exercise or just by lowering the calories, but the combination of lowering your calories and exercising regularly helps keep your weight to an optimal level, which, by the way, secondarily helps the other things. People who are at an optimal weight will have better diabetes control. better control of their blood pressure, and also, again, effects on the lipids. All right, so can exercise be bad for you? Well, this portly gentleman thinks so. He tried it once, but found that he was allergic to it. His skin flushed, his heart raced, he got sweaty and short of breath. Very dangerous. So this is a bit of an exaggeration in the sense that these are not signs of danger, but it also highlights something which is real. When you exercise, you are stressing your heart. At that moment, your risk does go up because you are making your heart work harder. So the heart rate goes up. That means the heart needs more oxygen to pump faster. The blood pressure goes up. So blood pressure goes up because adrenaline levels go up with exercise. That leads to the better blood flow to the exercising muscles. So if you're exercising with your arms, your leg vessels will constrict to maintain a high blood pressure to push blood into the exercising arm, and vice versa. Leg exercise will tend to do the same thing. So blood pressure going up with exercise, that makes the heart work harder. The heart has to pump harder, so the adrenaline stimulates the heart to pump more vigorously. Again, this helps provide good blood flow to exercising muscle, but the heart's working harder. Furthermore, we all know about sad stories about elite athletes who've died suddenly. So these kinds of things often occur during exercise. Now, most of these kinds of things are not run-of-the-mill heart events. Usually these are people who have some sort of genetic predisposition to dangerous heart rhythms, some type of cardiomyopathy. But it is also true that people who exercise excessively, 2-3 hours every day, or high intensities for prolonged periods of time, there is actually some evidence that you can see some damage to the heart through very intense exercise. So there are some things one has to consider when exercising in terms of the immediate effects on the heart, as well as overdoing it. And of course, couch potatoes beware. So if you have not been exercising regularly and the handle on your recliner does not qualify as an exercise machine, if you haven't been exercising regularly, you may be at increased risk if you start doing something very vigorously. So we'll talk about how to be careful in that situation. So we've talked about ways that exercise is good for you. We've talked about some of the risks of exercise and how it puts the heart at stress. And here's the paradox. How does a transient increased risk lead to an overall decrease in risk? So I did some high-level algebra here, calculating an average daily risk of a heart attack. So let's take an average 50-year-old person. What is the daily risk of a heart attack? Probably about 1 in 5,000. And that's based on an approximate 7% risk per year of having a heart attack. And if we divide that day into 24 hours, that means that the hourly risk of a heart attack is about 1 in 120,000. Now let's imagine that risk doubles during the time you exercise, which is approximately what is the case due to the increased strain on the heart that I talked about. So now within that hour, it goes up to 1 in 60,000. But because of all those other good things that exercise does for you in your heart, the rest of the day, it drops by 33%. So each hour, instead of 1 in 120,000, the risk is 1 in 180,000. So doing a little bit more math, and don't be intimidated by this, this can be stressful too. 1 in 120,000 risk for each of 24 hours changes to 1 in 180,000 risk in each of 23 hours, and 1 in 60,000 risk during that hour you exercise. And sort of looking for common denominators, that turns out to be a 26 in 180,000 risk for a day, or 1 in 7,000. And that's 28% less than 1 in 5,000. So we've subjected ourselves to a transient increased risk during that time we exercise, but over the course of the day, your risk has now gone down due to all those other beneficial effects. So how do we maximize the benefits? And I will point out that you shouldn't be overly concerned about these risks, because It's much better to exercise for 1 hour of a day than being dead for 24 hours a day. So we try to beat the paradox by minimizing the risk and maximizing the benefit. And we choose a middle ground in exercise, moderate exercise. So what is moderate exercise? Moderate exercise is usually defined as exercising at about 60 to 80% of your maximal predicted heart rate. The maximal predicted heart rate is on average 220 minus your age. So for a 50-year-old person, 60 to 80% of 170 would be a heart rate of 100 to 135. But I find that heart rate is very limited as a target for exercise. Sometimes it can be hard to calculate your heart rate, although nowadays we all have watches and Fitbits that do a pretty good job at it. But more importantly, these heart rate targets are based on population averages. So for any given person, you may not have as vigorous a heart rate response to exercise and might get the same benefit at a lower heart rate, or you might have a very rapid increase in your heart rate and feel fine, and you might artificially not exercise as much because you've, quote, hit your target heart rate. Furthermore, a lot of our patients are on medicines that block their heart rate from going up. Beta blockers do that. Certain types of calcium channel blockers do that. And people still will get a benefit even though their heart rate is not going up as much. And that brings me to a point I want to sort of digress on. A lot of people think that the reason we use heart rate as a target is because that is what is beneficial about exercise, is getting your heart rate to a certain level. But it isn't actually. It's not really the heart that we are exercising so much when we exercise. It's the muscles, the rest of the body, the blood vessels, all those things are what we want to have happen. The heart rate going up is just the means of making that happen and allowing you to exercise. So the heart rate going up is what we call a surrogate endpoint. When your heart rate goes up, it means you're doing a certain level of activity. But again, because some people are on medicines that block it and some people's heart rates don't go up as much, I actually discourage people from using a strict heart rate goal as a means of deciding that they're doing a moderate level of exercise. So a subjective way of looking at it is, how are you breathing? So your breathing rate goes up, but you aren't gasping. People who are, say, strolling in their neighborhood are being active, but they're not exercising. If you watch them and they're talking and conversing fairly consistently with whoever they're walking with, their breathing isn't actually going up that much. But you want to be breathing noticeably more than if you were just doing regular activity, but not so much that you feel like I'm gasping for air and I can't go more than 5 or 10 minutes. So I actually think looking at how you're breathing is probably a better means of assessing whether you're doing a moderate level of exercise. One of the ways we phrase this is, you can talk, but you can't sing. And sweating a little bit is good, but people have different propensities to sweating, so that's not a perfect endpoint in and of itself. And then our goal is about 150 minutes a week, spread over 4 to 5 days. That is a target that gets you cardiovascularly fit. All right, so back to some safety points. Listen to your body. If you were or are a couch potato, you may want to see your doctor before embarking on very vigorous exercise. It's fine to be active, take walks, things like that. You don't need to see a doctor before doing that. But if you want to try to get into better cardiovascular fitness and want to do a moderate level of exercise and you haven't been doing anything, you should touch base with your doctor first. The other thing is, pay attention to symptoms. So chest pain and pressure is not a normal response to exercising. If you start having that with exercise, stop. If it doesn't go away at all, go to the hospital. But if it does go away, let your doctor know, and then you may need further evaluation. We talked about shortness of breath as being a normal thing. Gasping for air is if that happens suddenly, that's not a good sign. And becoming lightheaded. If you're exercising and you start to become lightheaded, could mean you're overdoing it, but that could be the sign that you've developed an abnormal heart rhythm. People who are exercising will feel their heart beating harder. So in a sense, they do have palpitations because your heart's pounding. But if you're exercising and suddenly you feel your heart racing much faster than it was when you were exercising a minute earlier, that can be a sign again that you've gone into an abnormal heart rhythm, and that would be something that should lead you to stop and get evaluated. I told you a little sweating is bad, but suddenly breaking into profuse sweat could be a sign that your body is not happy, your heart's not happy, and particularly if it's associated with other symptoms like faintness or chest pain or pressure. Becoming pale, yet another sign that something's not right. So these are all things that should make you stop exercising, let your doctor know, and get evaluated. All right, so what are types of exercise? This list is certainly not exhaustive, but it includes things that can get you into a moderate level of exercise. An elliptical trainer is good. It's good for the heart. It gets lots of muscles involved. Bike riding is great. Probably not in the middle of the day in Tucson in the summertime, but in the winter or early in the morning in the summer, or a stationary bike at home. Swimming or water aerobics are good. Swimming is great for people who have joint problems because the water supports the body's weight, but it also provides resistance so that even walking briskly in the water can be very exertional without hurting your knees, but does create good moderate level of exercise. Dancing gets your heart going and gets your breathing heavier. Tennis, I put doubles. Singles is certainly fine, but singles can be more intense depending on what your level of tennis skills are. Trying to cover the court by yourself can sometimes reach a high level of exercise. It's kind of like doing wind sprints. Brisk walking or easy jogging. So if you're not used to exercising or you're older and running is a difficult thing, walking fast or walking in a hilly neighborhood or very light jogging can be a good form of exercise. Now, some people, it's hard to do any form of exercise, and the next best thing to exercising is to be physically active. And again, I kind of alluded to the fact that there's a difference between being active and exercising. Inactivity is very bad. Being active is better. Exercising is better still. So if it's hard to exercise but you want to be active, shoot for 10,000 steps in a day. But when people talk about what the, quote, best form of exercise is, I always tell them, do what you enjoy. Because if you buy some fancy exercise equipment and it's complicated or it's just not fun and you don't do it, then you're not benefiting yourself. So find something that you enjoy doing so that you'll continue to do it day in and day out. So other safety tips, avoid abrupt changes in intensity. So do a warm-up before you hit your moderate level of exercise. I exercise on a treadmill. My usual exercise routine is a treadmill at 15% grade at 4 miles an hour. But for the first few minutes, I'm going at 3 miles at a 10% grade until I kind of let my body warm up. And similarly, when I stop, I spend about 3 or 4 minutes to gradually decrease it. When you stop exercising suddenly and don't give yourself a cool down period, your blood pressure can drop very quickly, and that is one of the reasons people sometimes get lightheaded when they stop exercising. Avoid temperature extremes. Exercise early in the summertime, exercise later in the wintertime. And also consider the effects of competition. So for any given level of exercise, if you do it against somebody, it's going to actually be more intense. Your adrenaline levels are going to go up, and it could push you from being in the moderate range to a more extreme range of exercise. So consider that. So in summary, exercise at a moderate intensity, shoot for 150 minutes a week over 4 to 5 days, and listen to your body and look out for warning signs. But most importantly, have fun and do something that you'll continue to do. Thank you.
Yeah. So I know you mentioned, avoid extreme temperatures, but also what type of impact do things like humidity or altitude have?
Oh, good question. So, so humidity will make any temperature worse. And there's actually, although I couldn't give the calculation between percent humidity and what it does to temperature, there are apps that will tell you what the effective temperature is. So yes, definitely take that into consideration. I'm also a tennis player, and I've been playing tennis in 85-degree weather in the morning, in the last week, it has felt much worse than when I was playing tennis a month ago in 100-degree weather. And it's because with humidity, you have trouble dissipating heat. So the way we dissipate heat is we sweat, and the sweat evaporates, and it pulls out heat. But when it's humid, it's hard to make your sweat evaporate, and so you don't cool down as well. You don't tend to get dehydrated, but you can't get rid of heat. So do consider that. Altitude for other reasons. At altitude, your oxygen levels are lower. It's also much easier to get dehydrated because the lower pressures lead to an exodus of water out of your system. So make sure you stay hydrated. But there's not much you can do to compensate for the low oxygen levels. So just again, pay attention to your body. If you are an exerciser and you go to altitude, my advice is don't exercise that first day. Let your body start to equilibrate.
Does your heart beat faster in that higher elevation?
It will tend to, because it'll tend to compensate. So if your heart's not getting if the lungs are not providing as much oxygen in the bloodstream and your tissues aren't getting, therefore, as much blood, it will send signals to the heart to beat faster to make the transit faster and also beat harder. So those are all things that will create more stress on the heart. Good questions. Yep.
So somebody who has like tachycardia with POTS, a lot of people don't want to exercise because their heart rate's already super high.
Mm-hmm.
What is something that would be safe for them to do?
Mm-hmm. So that's a tough one. I haven't been asked that before. People with POTS, obviously you want to try to get that under control better. In terms of types of exercise, I would say you probably start off at a little bit lower level than you normally would. The lucky thing is most people with POTS are pretty young, so they're not as much at risk of having other heart problems besides the POTS. The other thing that can make POTS worse is being upright. So doing exercise in a non-upright position, like a recumbent bicycle, would be a good thing to consider. So that would be what I would recommend. Yes?
What is a safe type of exercise for, you had mentioned patients with cardiomyopathy. So for somebody like with hypertrophic cardiomyopathy, what would be a safe exercise for them to do?
Okay, so let me answer more broadly with cardiomyopathy. People with the most common type of cardiomyopathy, which is actually diminished heart function, like previous heart attack or virus or something like that, if they are compensated, meaning if their cardiomyopathy is treated, they're not actively in congestive heart failure, they can do the same types of exercise that other people do. Hypertrophic cardiomyopathy is, for people who don't know, it's a genetic cardiomyopathy that leads to abnormal thickening of the heart muscle, and there are some potential complications of that. One is that the heart, in a sense, obstructs itself. The heart pumps so vigorously that it actually shuts off the outflow of blood out of the heart. So a very important thing for hypertrophic cardiomyopathy patients is to not be dehydrated, because dehydration will tend to accentuate that tendency to obstruct. In fact, we call it hypertrophic obstructive cardiomyopathy. People also have a tendency to abnormal heart rhythm. So I would say anybody who has a hypertrophic cardiomyopathy before they embark on exercise definitely need to see their cardiologist, have a stress test to make sure that they don't have any exercise-induced abnormal heart rhythms. Once a person has been cleared, though, I wouldn't say that there are particular forms of exercise that are better than other forms, but in general, people with that condition are usually prohibited from very vigorous sports, competitive sports. It often disqualifies young athletes from playing football and things like that. But in terms of moderate jogging and biking and things like that, with the provisos of what I said, that should be okay. Yes?
What do you think about pre-workout mixes and powders and all that stuff?
I am not a big fan.
Okay.
Partly because my bias is to want more scientific evidence before recommending something, and scientific evidence generally means that you do a a study where you randomize people to the substance versus a placebo. And since all of these things are natural and don't require that kind of testing before going to market, none of them have that. And I've seen so many people who take things like energy drinks and not only stimulants, but unusual vitamins, and often they actually have bad consequences. People's hearts will race, and I think a lot of it is marketing. So best thing to do is eat healthfully and stay hydrated. That's the best thing to put in your mouth before you exercise. Any other questions?
Thank you very much.
Sure.
Is there any other questions or anything? You guys drink